say ačiū, Roberta? Yes? Okay, so. And, okay. Good morning, everyone, and thank you for inviting me to speak and to be here with you. It's my first time in Lithuania, and it's the first time at your congress, and I want to thank the Lithuanian Association for the invitation, especially Neringa for being so wonderful in helping me come over and present, and the University of Klaipėda for hosting this wonderful congress. So, as you can see, it has been translated. I'm not going to even try to read it. It's the same as you trying to read Greek. So I will do my best while I see through my notes, and excuse me for that. So, today I'm going to talk to you about building confidence in psychology from a European perspective. So I'm going to go through a little bit of an outline on how psychology developed throughout Europe, how EFPA became EFPA and what it is today, and what that means on an actual level, both at the European level for EFPA, but also at the national level. So locally, what the impact is, and what are some of the challenges that we face as psychologists, but also what are some of the opportunities and choices that we are called upon to make. So this is Brussels, and we send you warm greetings. This is where we go and meet very frequently. That's where our head office is. And this is the plan for today's talk. So I'm going to start with a little bit of history. I want to apologize that we excluded a lot of the information about Eastern Europe. That's usually the case. It's actually... very interesting to me, and it's something that I've started noticing a lot more. When we talk about European psychology, it tends to be Western psychology, and today I found out, even though I didn't understand many of the things that were said, that psychology has had a great history in Lithuania, and I think it's the same thing for a lot of Eastern European countries as well. And we need to start acknowledging that even more as we go along. So, a little bit what I think we all know about Wundt. I think I made out Freud's name a little bit earlier from what I could understand here and there. And then slowly but steadily we have the first International Congress of Psychology in Paris in 1889. So we start seeing the development and the interest. And actually what was said about psychology in Lithuania being started from other people, not psychologists as such, is true, I think, worldwide. Because Wundt was not a psychologist either. And then we have the first associations being formed, so in France and the UK in 1901, in Germany in 1904, and then in Italy in 1910. And gradually we see all the other ones being formed across Europe. The interesting thing is that while we have international cooperation, we have mostly national developments, and this goes with the territory. So people always tend to collaborate with people they know, they have common history with, they have common language with. Even religion plays a role a lot of the times. So we have legal context, we have national context of psychology developing throughout Europe, and we see connections based on areas. So we have Italy, Spain, and Portugal mostly collaborating with each other, Germany, Austria, and the Netherlands, France, Switzerland, and Belgium, the Scandinavian countries, the Nordic countries together, and then, UK and Ireland, and the Mediterranean countries all together, or most of them together, depending geographically where they are. So even though psychology is developing throughout Europe, we have diverse types of psychology. We have diverse kinds and diverse developments and speeds. So how did EFPA become? At 1981, 12 presidents of national associations, mostly Western again, founded the European Federation of Professional Psychologists Associations. So it was a focus on psychologists providing services to the people. This is why it was a professional focus, not so much academic. But then as the time went by and they realized that it's not just professionals who do psychology, it's also academics, it's a broader context, and psychology doesn't pertain only to doing psychotherapy, for example, or counseling. It has so many other services. They decided to grow the association, they decided, the federation, they decided to grow its mission. So in 2001, it was renamed European Federation of Psychologist Associations to reflect this remarkable growth. And I think that you can see the numbers in there, how they grew over time. And it started to involve other countries. So it was mentioned earlier that Lithuania became a member in 2008. I know Cyprus became a member in 1995. So there's different countries coming in and different countries contributing and becoming more involved at the European level. What did that look like, though? Okay. Initially, it was the focus on the psychologist's needs. In the first 30 years, it was focused on what do psychologists need from Europe? What do psychologists need from each other? And then at some point we realized that our profession has to do with society. It has to do with people. It has to do with society needs. Therefore, we cannot just look at what we need as a profession, but we need to see how we can best serve people. So we gradually changed our mission, and we recognized that the expertise of psychologists implies a responsibility to serve people and to serve society, if we want to be true to our call. Because I think that if I were to ask all of you here, how come you became interested in psychology and what intrigued you to get into psychology, most of you, I think, would be a safe guess to say that you got into it because you wanted to help people, not because you wanted to help yourself. Well, maybe a bit, but that's a different story. And there needed to be a balance between how much we ask to be given and how much we give back to society and how much we give back at both the national and the European level. So the focus at the European level changed also due to the policies and the decisions that were being made that affected both the psychologists and the clients and the service users. So, how is EFPA today? EFPA today is comprised of 37 members, and the members are not only national associations, they can be federations, they can be networks, and this is because there is an effort from EFPA to try, or an encouragement from EFPA to try and unify psychologists around. We do recognize that there are differences in perspectives, there are differences in opinions. We are people, and we do have exchanges sometimes that cause us to drift apart. At the same time, we recognize that to be the best that we can be and to offer the best that we can offer, we need to come together. And so we support through EFPA the development of these federations and these networks. We also have more than 12 associate members and affiliate members at the European level, so that is the Students' Associations, for example, the Health Psychology Society, the European Cognitive Psychology, and so many others. And this is because we recognize that collaboration is an important aspect of being successful and being heard. And it's different to have one group of people coming or one person coming and asking for a policy change, and it's a different thing having a group of people who collaborate together and have a common platform. So we have joint representation, and we also have joint action wherever we can do it. So there's a lot of interaction with EU institutions and other international organizations. And what does that look like? Sort of like this. So we recognize that there is an importance of being present. So present means being in commission meetings, being in actions, being in policy meetings, being in different organized groups that act at the European level. And this is also important at the national levels. So we recognize that national associations play a significant role in being present in their own country and promoting psychologists and psychology's role in being involved in policy development, in advocacy for their clients' rights, for psychologists' rights, and all that. So I can give you a solid example right now, actually. One of your colleagues who's a member of the association and who's representing Lithuania in one of the boards that we have on psychology and health is right now in Brussels. Ruta Sargautite, if I say it right, yes. We have been called upon to present somebody with an expertise on patient empowerment. And she was very grateful in accepting to represent EFPA and in return Lithuania. And in Gamian is a European organization that promotes patient empowerment in presenting psychology's role in patient empowerment. And she's now in Brussels in a talk with politicians about promoting patient empowerment and what can psychology and other professions do at the same time. And this is information that we usually get and report back to the national associations as well. So it's sort of a chain reaction, if you will. And this is very important. Why? The side note is very important for me. If we don't do it, if psychologists don't do it, then other professions do. Other professions come, other health or mental health or other social science professions take over, and we get sidelined, and then we feel ignored, but we don't know how to get in again. And the impact of that is really important. We need to take that into consideration when trying to be present. So, continuing on, saying that Europe needs to know what psychologists can offer to learn to seek their views and contributions, as done with other professions. So EFPA is trying to get European institutions to realize that, you know, psychologists have something to offer, and it's important for us to offer it. So please invite us, please involve us. We are here, we're present. And at the same time, this also happens with the national associations, also letting the governments know that psychologists are here. Psychologists are here and they can help. Psychologists can contribute, and this is what psychology can do. And this is what the areas of psychology can do. So please use us in policy development. And actually I can give you an example from Cyprus, because our association has existed for 38 years. And more or less it is in the laws, not just our law for the profession, but in the various laws about violence against families, or treatment, or people getting out of prison, and all the, the committees that we have, yes. It is in there, it is in the laws that the Psychologists Association needs to be present and contribute to the psychologist aspect. So when the talks happen in the parliament, we're always invited, we're always present. So this is how it happens. And then representation at the European level affects policies and decisions that affect the research, that affect education, they affect the professional work that we try to do. So there's a lot of opportunities at various levels, both national and European. So for EFPA, I'm trying to see the time, okay. As a cooperative platform, we act as a coordinating role in matters that concern its members. So we obtain better information from Europe, and we try to pass it on so that associations who are members know what will happen, or how it will happen, and how it will affect them at a national level. We try to work together and share knowledge. We try to develop common standards and models for professional activity, and I will talk to you later on about Euroside, which is also implemented here in Lithuania. And then we try to improve professional ethics. We have an ethics meta code and a sample code of ethics that can be used. And we try to influence national legislation with regards to what the standards should be for somebody calling themselves a psychologist and practicing psychology. So you will see that through our work we have the various standards, but we also have information leaflets like the Europe for Psychology, information on the EU for psychologists. We have the reference guide of the universities. We have the Europe collaboration with Kongreso for the European psychologists, which is a scientific journal. We have our news magazine, which goes out every 3 months, 3 to 4 months, and it has news from Europe and psychology and opportunities for involvement. And what does that look like ultimately? It's like this. So we have the European level, and we have the European institution, and then we have the national governments that have the direct link, but then we also have EFPA and the member associations. The member associations are the psychology associations, or the federations that I was telling you about. And there is a continuous interaction between all these levels. So, Eurosci is a European certificate that notes the standards for psychologist education, training and competence. It is developed, or it has been developed, because it was noted that if somebody studies psychology in Lithuania, it's not exactly the same or necessarily the same if they study psychology in the UK, or if they study psychology in Cyprus, or if they study psychology in Germany. So we noted the diversity. And we said, okay, we need to create a common understanding what psychology is, or what psychology studies entail. And then we defined the minimum standards, so it's not the maximum, it's the minimum standards for somebody to be called a psychologist. It covers profession as a whole, thus helping maintain psychology's integrity and identity, and I will tell you about the identity part later on. And it's applied to all of Europe, which helps strengthen the position of psychology in Europe and globally, especially when we belong to the European Union and we want mobility. And actually psychology is in the top 16 professions for mobility in Europe, we do need to have common standards to improve that and to help that process. So, what does it mean? For those of you who may not know, it means 6 years or at least 6 years of professional education and training. So we have at least 5 years of academic education with a proper scope, so proper field of practice that we go into. 1 year of supervised practice, so we go out there, we find a placement, we find a supervisor, and then we get proper supervision and guidance in implementation, and declaration of ethical behavior and obligation for continued professional development. And this is particularly important when we consider that we're in a profession that changes and evolves, and we need to evolve with it. So this is a map, and you can see Lithuania at the far end, and it's implemented in 24 countries. And this is the website for those of you who might want to visit it. It's eurosci.eu. But now we'll get into something that might be mostly interesting or intriguing for you. We're going to talk a little bit about the legal status of the profession, because a lot of the times we don't understand it, and I think that Lithuania is at a particular point in time when there's discussions about the legislation or not, and what the impact will be or what it won't be. So I think having some data and having some background can help you understand better what happens at the European level and how that impacts your country. The European Commission produced a report on the 29th of April 2016, and I actually 2 years ago, exactly to the date, I was in Brussels participating in a meeting for the Single Market Forum, which means promoting mobility and promoting diversity in the European Union. So I will talk to you a little bit about that later. This was an exercise done by the European Commission to evaluate the regulated professions that exist in Europe. So it's an overview. If you want to Google it, you can find the whole report. It exists in many languages. It can be very confusing, but please, if you have the time and you want to read something that's very dense, go for it. The report is based on information transmitted by member states discussed in the meeting on the 6th of March of 2015. You will say, okay, it's 2018, it's almost 3 years later. Well, it is 3 years later, how is that pertinent? Things haven't changed that much, so I would say it's pretty representative. So the aims were to facilitate mutual evaluation of qualifications, so to see how similar or different the qualification requirements are in Europe, but also to see how this can improve professional mobility. So I will start with some statistical information, and this might be something interesting or something new for you. The International Standard Clarification of Occupations, ISCO, classifies psychologists under Section 2, professionals, and subsection 263, social and religious professionals. So internationally, we're classified in the same category as priests. Now, I don't know about you, but I don't do confession. I don't relieve absence of sins or anything else, but for some reason it has been decided that we're in the same category. And again, underneath that there's a subcategory for psychologists as a separate profession. This is also available online if you want to Google it, and you can find the definition of ISCO for psychologists. Now, in some countries it's part of health services, in some countries it's part of social services, in some countries it's not part of anything, it's independent. And then the interesting thing for me was that in Western Europe we have about 100 to 150 psychologists per 100,000 residents, whereas in Eastern Europe we have about 50 per 100,000 residents. So I think that this reflects somewhat the amount of universities in the production, but also the amount of people who actually go into psychology after graduating, or it can be reflecting the lack of regulation in a lot of countries, and that it's not easy to say who's a psychologist and who's not. So, existing legislations cover from 1 up to 10 different professional categories. So there can be a single category of psychologist, or it can be other categories, like in the UK they have the practitioner psychologist, but they also have clinical, they have counseling, they have forensic, they have sports psychology, they have psychology, health psychologists, and educational psychologists. Actually in Cyprus we have that too, apart from health psychology and sports psychology. So it really depends on the country, and there are countries that have legislation or categories for specific aspects or areas of psychology, like clinical or school, but they don't regulate psychology in general. And I mentioned already that it's 16 professions for mobility. The study duration is a minimum of 4 years, and I would say that this is only true in Greece. Greece requires a psychologist to have only 4 years of undergraduate education, no master's, no nothing. And then they get a license to practice as psychologists with only 100 hours of supervised practice, and then they're encouraged to do a master's. They're encouraged to do supervised practice, and most of them now do. But there's resistance to change the legislation and implement the regulations that were voted to have the master's. So the regulations are there, they're just not really implemented, which is a unique situation. And then we have a maximum of 12 years of education. The 12 years of education shouldn't worry you too much, because it usually refers on specialized education, so above the master's level. It usually refers to clinical psychology, which is required to happen after the master's level for a lot of countries, but it's not always the case. So we have a big range. And it's usually followed by mandatory supervised practice. So after the 6 years, there's mandatory supervised practice. And in some countries, actually only 3, require an exam, either oral or written exam, to get licensed. But this is a minority. So, the legal status going on. There are countries that have no legislation. However, you will see that, for example, in Latvia, when the report came out, they were in the process of voting in their new legislation, and now it has happened. They have a new law in Latvia. Lithuania, as far as I know, is in the process, and it's in discussion. Luxembourg doesn't see the need to have a legislation because they feel that the service users will be able to make their own mind. Estonia has a law for school psychologists, and they're thinking about clinical psychology, but not any subspecialty. Germany has none for psychologists. They do have, though, for clinical psychology. Not anybody can be called a clinical psychologist. And they have for psychological psychotherapists and child and adolescent psychotherapists. And Bulgaria has none, but it is unique in that only the ones who have a master's degree in psychology are allowed to practice in the health sector via the national health system. So there is regulation if you want to work in the public system, but not outside of it. So here I will make a note to say, please do not try to add up the numbers. Okay, they don't add up to the actual number of members of the European Union, because we have overlapping laws and overlapping regulations. So we have 17 country members that regulate the title of psychologist, who can be called psychologist. The majority of them require a master's, like I said earlier, and supervised practice. We have 9 countries that regulate healthcare psychologists, and then we have 13 country members that regulate clinical psychologists, with 3 of them having subsections, like clinical neuropsychologist, clinical child psychologist, and other. And I will say this, the number should read 14 because Belgium recently regulated clinical psychology as well. They only had healthcare psychology up until now, but they managed within the last 6 months to pass a new law. And we have 11 country members that have other areas as well. So in addition to clinical, in addition to psychologists, they have other ones. So we have traffic, we have forensic, like I said already, organizational school, sports psychology, and stuff. The interesting thing is here that there's the differentiation between healthcare and clinical psychologists is not always clear. So you have countries that you have healthcare, but you don't have clinical psychologists, and this is because there's an overlap. So it depends on the national context, really, and this should be taken into consideration when the discussions for the law are being made. So, registration with a professional body. So 9 country members have obligatory registration with the National Association, as you can see there, and Lenkia is Greece. Ah, okay. And, yes, sorry. And 13 country members not. Actually, I need to say this, for Kypros, it is not obligatory. However, for us to participate in the licensing body, we have to have a specific percentage of the total number of licensed people to be able to represent our members and psychologists on the licensing board, because there's 3 psychology associations in Cyprus right now. Now, you will say, you know, what is the need to belong to a psychology association, or why should it be? Are there pros or are there cons? There can be both said, okay? There are associations that do a lot of great work and try a lot and promote things. There are associations that are dormant. I know our association in Cyprus was dormant because of the differences that we had between us, and this is how the other 2 were formed eventually. But ultimately, belonging to a national association is I could say important because you create common education standards, you create common ethical standards. You have a way to be a part of a community. And I will connect that to my next slide, because a lot of the time, if we don't belong, we cannot defend ourselves as psychologists, we cannot identify ourselves as psychologists. We're just one, we're just a single entity. And this is harder to participate in policy making or in advocacy when there's not an organized situation. And also, it's also providing support to each other, but also participating in the growth of the profession. Not just by going to congresses like you are right now, but also contributing with your input and having an impact greater to the profession as a whole and to the future of the profession. So, why do people say that they need to have a legal standard or a legislation in their country? 16 members of the European Union noted that they needed it for the protection of service users and securing quality of services. 17 countries also cited protection of public health and patient safety. Only 3 noted that it's public safety, but only to specific associations like gun possession, which is a big thing right now in the US, for example, or where they have a lot of gun violence. Getting a driver's license, especially for older people. The forensic evaluations, having people who are qualified to do forensic evaluations for people getting out of prison or being competent to go to court, to enter the police force and to graduate as a police officer, and all these other things. Children's safety is highly cited, only cited by one country, but I know from discussions with other member associations of EFPA that it is a big issue. We want professionals treating children and offering services to children or doing research with children to know what they're doing, to secure that children's rights are not being violated in any shape or form. And then public policy in general. Now, going back to what I said about the Single Market Forum that I participated in 2 years ago, I want to ask you this. I want you to imagine for a minute where anybody can be called a psychologist. Anybody and everybody can be called a psychologist. Okay? And when actually florists are considered the same as psychologists. Priests are considered the same as psychologists. A hairstylist is considered to do the same job as a psychologist. So there's no law, it's just anyone and everyone can be called a psychologist. Okay? And I want you to imagine for a second what that would be like. Because when we went to that meeting 2 years ago, basically the argument for reducing legal standards, not eliminating them, but for reducing them to increase mobility was, well, there's doctors and then there's everyone else. So doctors, because they offer services, they should have legal standards because they need to be held responsible. Well, we're not doctors, we don't operate, but we do operate on people in a sense. We do work with them. So how can we safeguard the profession and the service users if there's nothing to say, okay, you've made a mistake, you have the responsibility for it. Okay. So it's not just about safeguarding the public, but it's also about safeguarding psychology. Your colleague who received the award earlier talked about being proud. Nowadays, because sometimes we have a lot of issues between us, it's an issue saying that you're a psychologist, because I know in Cyprus, for example, whenever we go to the parliament and there's 3 groups, they say, do you agree between you this time or not? Are we going to hear a common voice or not? If you can't agree between yourselves, how can you help us with the policy? So it's important for us to come together and try and build a solid group as psychology and promote a single psychology identity. So, what are the choices? What are the challenges? What are the opportunities? We face a lot of challenges, both at the European level and at the national level. And these are challenges that were identified back in 2011, but these are challenges that we continue to meet today. And I think that the European challenges are reflected at the national level, and also the national challenges that I will talk about in a minute also are reflected at the European level. So, we have a gap between politics and psychology. There are too many issues that psychology can be involved in. Unemployment, social exclusion, violence, work stress, mental health, institutionalization or deinstitutionalization, migration, internet safety, violence against children, social media, anything, you name it, psychology can be involved in it, okay? So it's hard to put priorities, to set priorities and say what's the most important things, okay? what should we be involved in as EFPA, but also what should we be involved in at the national level, and how do the two interact? So choosing the right ones to focus is hard, and can be hard to know what's right for the people, for our people nationally, but for our people in general. And this creates an issue in knowing what doors to knock on and where to reach out for help or for collaboration many times. So time goes by, and we miss opportunities as a result. So this is one of the challenges that we have to meet. Building commitment in members and representatives, as well as our action to build on expertise and reputation. We need to find the right people who can help us and help move forward the messages that we want to pass on for psychology and for the service users. Delivering results that can make sense to policy and practice and the profession, but also keeping momentum, basically not losing time, not losing the effect that we can have and the impact that we can have, because we're still talking about something and we still haven't made up our mind. So the choices are for the way we link politics and psychology, focusing our efforts, but focusing also our budget, but also us as psychologists being involved, because I think though, that in Lithuania you're all probably the same as in Cyprus and many other countries, we're all volunteers, And when you have a primary job, it's still hard to balance your private life and your private job with offering to the profession. And a lot of the times we miss out because we don't do it, or we do it fragmentedly. We do it in small chunks or whenever we have the time. And this poses an issue because then we can't follow through, and then the policy gets implemented and we lost our time, we lost our chance. So we need the group so that we can collaborate with each other. Results are sometimes small, but at the same time bigger, but the visibility and the voice and the impact of psychology is very important to keep things going. So at the national level, which affects the European level, so we have the national perspective. Well, if it's not good for our national association or for our country, then we shouldn't be involved in it at a European level, or vice versa. Despite the European efforts, education and research remain largely national, so there's no coverage at the European level. For associations and the members, national interests prevail over common ones, and national identity and culture often come with the belief that our own solution is better, and as well as the ambivalence or skepticism towards Europe. And we need to recognize that. Being European Union members doesn't automatically make us be invested in the European Union or the European perspective. And this affects how we do. This presents as a risk for psychology because we miss out, or we don't evaluate on time, or we don't want to hear, or we don't want to get involved in this. So, what does that mean? Fragmented, like I said, involvement, and actually not using, I'm missing something. There it is, okay. So instead of looking at the bigger picture, looking at the smaller picture. What is affecting me as a person, or what is affecting us as a small group, rather than what is affecting the bigger group. And the bigger group could be the national level group, not necessarily the European level. So, the choices that we're called to make. We need to remember that psychologists deal with the same people in different settings and throughout life stages. So it doesn't matter if I'm a clinical psychologist and you're a sports psychologist, or you're a health psychologist, or you're a child psychologist. We're all dealing with people, ultimately, and we're all doing psychology, and we're all starting from the same point. So psychology should be depicted as a unitary, multifaceted discipline with a diversified profession, so application, and dealing with well-being, health, performance, participation throughout the lifespan, and the other many areas of practice. So belonging to the psychology profession means overcoming this and making the choice to collaborate with others, making the choice to work together, and promoting participation at all levels so that we can all benefit, and our clients can benefit, our service users can benefit. So, before I close, I have some words for you, a special word for you. I would like to encourage you to look at the bigger picture. It's sometimes very hard when we're impacted at the national level or at the individual level to look at the bigger picture. Sometimes we win, sometimes we lose, sometimes we gain something, sometimes we don't. And it's difficult to emotionally make a decision that is for the greater good rather than for the individual good. And I know that because I live that every day in my country as well. When my students come at the university and say, Dr. Karayianni, how are you going to help me get a license? How are you going to help me do this? How are you going to help me do that? And when I tell them about psychology and history of psychology in Cyprus, it's kind of like, yeah, you know what, but what's important to me is for me to graduate and get a license and open up my private practice. I don't care about psychology in Cyprus right now. They don't realize the fact that once they go out, that they represent psychology. And if we're not proud of our profession and if we're not together, how will psychology continue to exist? How will people feel confident in coming to a psychologist in Cyprus? And I think the same goes for everywhere else as well. So we don't want to damage our profession. We don't want to cause people to lack trust in us. We don't want to, we want to build confidence. We want to be proud, like your colleague said before. And we want to be able to represent the importance that psychology has to play in society's challenges, in people's challenges. And by doing that through a unitary community, through a single community, as much as possible, despite our differences, because we're supposed to be behavior experts and communication experts. And if we cannot do it, how can we help others? So, that's you, everyone.